Hello everyone and welcome back to my channel. So in today's video we will see the important topics from thorax anatomy. So first we will see the LAQs. First LAQ is on bronchopulmonary segment. In this you need to mention definition. Then you need to draw the diagram of lungs showing bronchopulmonary segments and you need to enlist the names. Then you can also write the relation of pulmonary artery and vein and applied anatomy or clinical anatomy. In that you can write tuberculosis, bronchial asthma and so on, which is given in the textbook. The second is on right atrium. In this you need to mention position, external and internal features and tributaries or inlets. You need to draw the diagram also for this, and you need to also write the development of interatrial septum. The third LAQ is on heart. The subtopics are mentioned over here, that is general organization, external features, blood supply and clinical anatomy. In blood supply you need to mention both atrial supply also and venous drainage also. Make sure that you are drawing diagrams in all of your answers to get more marks. Then coming on SAQs, the first is contents of typical intercostal space, and that you need to mention muscles, veins, artery and nerve, all that. And second question is structures piercing cleidopectoral fascia. The third is right lung and the fourth is left lung. This both combined question can also come in form of an LAQ. So in this also you need to mention the features, that is apex, base, borders and surfaces in detail, fissures of each lung and lobes, and that impressions which they make on mediastinal surfaces. Also the supply of atrial supply and nervous supply and venous drainage. Next is structures passing through hilum of the lung. Then what is lingula and bronchopulmonary segment can come as a question. Then relation of mediastinal surface of left and right lung. You need to draw diagrams for everything. Then contents of posterior and superior mediastinum. Contents of every mediastinum is important, but superior and posterior mediastinum comes frequently. Then there is branches of right coronary artery. In this you need to draw the diagram also. The next question is pericardium. In this you need to write the features, the detail about fibrous and serous pericardium, sinuses, contents, blood supply and nervous supply. Then interior of the right atrium, you need to also mention the openings with the diagrams, that is inlets and tributaries. Next question can come on arch of aorta or else branches of subclavian artery. So these are the important questions that are usually asked in thorax anatomy for BDS students. I hope this video was helpful. Do like the video and share it to other BDS students and do subscribe my channel. Thank you.